Hi, I'm Dawn Laney. I am a genetic counselor and assistant professor at the Department of Human Genetics at Emory University, and I'm here today to talk a little bit about reproduction in Fabry disease. Here are my disclosures. I do a lot of work in Fabry disease, so you can see that I do research and help advise people and also give a lot of lectures and do a lot of helping, I hope. I'm also a co-founder of Think Genetic. So let's talk about making babies. No, the stork doesn't bring them. But we know that a lot of babies are born that are very planned, and we know a lot of babies are born and they were completely a surprise. So what I'm trying to do today is for anybody in any stage of making decisions about having babies, just trying to lay the field so we all have all the information about having a baby when you're living with Fabry disease, so that we're able to all be on the same page and have the same information. So why are we talking about this? I think my amazing student, Sarah Macklin, for her thesis, talked to women and men with Fabry disease and asked them how do they think about having babies and how did they have their babies. So in this case, this is a great quote from a woman with Fabry disease, and she says, I think if you gather as much information, because it's out there, it's not all together in one place, but it's out there. If you research and you get informed, you can make a decision that fits you. So for me, this is an attempt to bring all the information into one place instead of making you hunt and peck around, so you can learn about the basics of things you should think about, maybe if you want, when you're living with Fabry disease and considering having kids. My goal is also to help you avoid frustration. Here's a woman here who says, the doctor didn't give us any options. And I know there are different options. You know, this information I found out after we had a really bad experience with a fertility specialist. So in this case, is a woman who was out there and had to try to figure out all the information, but didn't get it in time for her, which was frustrating. So I'm hoping to decrease frustration for you guys as well. One thing that we do know is that when you have a genetic condition like Fabry disease, they've done research that shows that you make decisions a little bit different in having babies than people who don't have genetic diseases. And factors that really are present there when people are making decisions are three things. One is there is a chance they could pass on Fabry disease. And so one thing they think about is what's that chance? One is the hope for a new treatment. Are they going to have babies now? Or are they going to wait 5 years? How are they thinking about the new things that are on the horizon that give us great hope for better outcomes and better treatments versus right now where you just go for it and you've got what we got. Also, we know there's a big difference in severity with Fabry disease between different people. So even within a family, and that can also make people think like, oh, what does this mean for me or my children? And how does this impact how I think about having babies? So that first point, the X-linked inheritance, we know that men with Fabry disease, they all have one X and one Y. And when they pass on that Y, it has nothing to do with Fabry disease, and they're going to make a son. That son cannot have Fabry disease unless something very crazy happens with our genetics, which could always happen, but doesn't really happen. So when they pass on their Y, their sons will not have Fabry disease, unless their moms have Fabry disease. If you've got a man who has Fabry disease, then the only X he has to make his daughters is going to have Fabry disease, so he's going to pass it on. So when we talk about the average situation, a man with Fabry disease will pass on Fabry disease to all his daughters and none of his sons. Now, a woman with Fabry disease resets that whole chance because women have two X's and they're going to make sons and daughters and whatever, but they have no control over that. They're just passing on their X one way or the other. And only one of those X's usually will have the gene changes that causes Fabry disease. So in that main situation, 50-50 chance each time they have on one X or the other X and pass on Fabry disease or not. Again, that resets with every pregnancy, so the chance always is 50%, whether they've had 4 kids or 2 kids. And this is just a visual way to look at it. Some people really prefer to look at it graphically. In this case, you can see in the upper section, there's a man with Fabry disease, and he's got his X that has the Fabry change on that gene, and he's got a Y that has nothing to do with Fabry disease. And then down on the bottom, you can see a mom who's got Fabry disease and how she's got 2 X's and a 50-50 chance of passing it on. And this is how a woman with Fabry disease broke that down. The genetic counselor broke it down. You have a 50-50 chance of having a boy or a girl. And if you have a boy, then you have a 50-50 chance of them having it. And if you have a girl, you have a 50-50 chance of it. So that's just another way of saying, if you're a woman, you're going to pass on one X or the other, and either will pass on Fabry disease or not, but the gender comes from the dad's side. that's 50-50 to have a boy or a girl too. So she just pulled it together. So when we think about how people approach having babies when they're living with Fabry disease, they all have different opinions because everybody comes from a different walk of life, have different experience. Everybody's got different decision-making processes. So I'm going to walk you through a few of the quotes we got from Sarah's project that scan from just having babies to doing a lot of consideration and either not having children or deciding that they're going to go through different procedures ahead of time. And I'm just showing these because I think it's important to know that in the community of Fabry disease, everybody has different opinions, and that's fine. That's how it should be. So here's a lady who said, when we got married, we knew we wanted kids, that they could have Fabry disease, just didn't change that. We talked about that when we wanted kids and just started trying. Here's another viewpoint. I looked back at my life that my dad had and was really sad that I'd pass this on to my son and daughter, but in the same sense, it's something that we are going through life hand in hand and making it work. It's kind of nice to relate with my son sometimes and be able to talk to him about enzyme replacement therapy and help him along the journey, as well as we're both doing this. So he had the viewpoint of somebody who just had babies the standard way, didn't worry about it too much, just saw what would happen. This is another woman who chose to have kids. And in this case, she at first felt a little bit down about it, but then realized that it can be nice to have something in common with your kids and walk them through in ways that you've experienced yourself. Yes, all my kids have Fabry disease and we're making it work with that treatment. I wouldn't change a thing. So that's a woman saying, I just went and had kids and they have Fabry and we're good. We're good. This is another viewpoint. If it's even a tenth of what I've gone through or what family members have gone through, I just couldn't do that to anyone, let alone a baby or a child. Where you're taking a risk, it's 50-50. So in this case, this woman was not comfortable having kids. I think when I first found out that my son had it, I cried and I felt guilty, and I think that it can occur with other patients that have children or are thinking about it, but I think there was a guilt, but I just got over it and it kind of pressed forward. So in this case, this woman had a baby with Fabry disease, had a son, and she, took a second to mourn that Fabry was happening for her kid and then just gone on with it. And these are all just different viewpoints about how people think about having kids when they have Fabry. And here's a final one. So knowing that all the males will not have Fabry disease and all the females will have Fabry disease, we decided that the only option is IVF because we don't want to risk it. We don't want to risk trying naturally. So would you guess this is a male or a female who has Fabry disease in this case? All right, our clues are males will not have it, all females will have it. That tells it that this is a quote from a guy. Good job. It's like Dora the Explorer, Donna the Explorer. Okay, so how does this work? Well, the first thing you need to do is before you have your baby or considering having a baby, or maybe even considering getting ready to have a baby, you talk to your partner and you figure out what makes the most sense for you. One option is just keep calm and go and have some babies. Don't have to think about it anymore. Maybe you think about next when you will test that baby after you have them based on the risk they have. Some families may choose to adopt. Some family options may choose to have a donor egg or sperm, depending on who it is that has Fabry disease in the family. And some people may use an option called Preimplantation genetic testing, which comes with in vitro fertilization. This is before you try to get pregnant. You go to a doctor who specializes in reproduction, and you say, I would like to learn about, what it costs and what my insurance covers or what the health system covers, so that I can look at the embryos that are put together in a test tube and figure out which ones we put back who don't have Fabry disease. This can be a pricey process. Some countries cover this, some countries don't cover this. But basically what happens is a woman takes medications and she makes eggs and they harvest those, which is not the most comfortable process, mind you, but they take those eggs out and then they get some sperm from the husband, which is a much easier process, and they put them together. They let the embryos divide, or they let the fertilized eggs go divide a few cells. Then they take out one of the cells and they test it for Fabry disease. Now, in order to do this, they're always going to first find the gene change in the parent that has Fabry disease, so they can make sure they're looking for the right thing. And then they'll let the embryos continue to grow. and the ones that they use, they put back, are the ones that you choose. So if you're just looking for, if you're a man with Fabry disease, they can look for girls and boys and just put back the ones that are boys. If you're a woman with Fabry disease, they can actually test for the gene change and only put back the ones that you choose, whether it's boys with Fabry disease, girls with Fabry disease, embryos with neither. Is it an easy process? No, because they're going to do this. They're going to put the embryos that you want back, and then you're going to grow them. And they're going to watch you real closely during the whole procedure. But this is an option. It's something you can do to prevent kids from having Fabry disease. But again, it's not for everybody. This is just an option that's out there. All right, so what if you were currently pregnant, or you just chose to go for getting pregnant, and you want to know before the baby's born if they have Fabry disease? Or do you want to know as soon as they're born if they have Fabry disease? Or do you want to know later down the road? So this is the next decision point you have to make once you're pregnant. If you didn't go through IVF and preimplantation genetic testing, this is the point where you determine when you're most comfortable and when you think it's most useful to determine if your future baby has Fabry disease. If you do prenatal testing, often people do this for reassurance to find out if the baby has Fabry or not, or they want to plan so they know exactly what they're looking at when their baby's born and if they have Fabry disease. Or they may choose to think about the pregnancy, and if it's affected, consider termination. Now, again, these are all different decisions that people in the Fabry community have made over time. There are two main ways we look and see if the baby has Fabry disease before birth. The first thing you have to know is the gene change that's there in the individual with Fabry disease that's getting the testing done, whether it's the mom or dad. And they'll usually ask for a blood sample. They want the result, and they also want another blood sample, and often they're going to verify that as well. And the tests that are most correct, so the diagnostic tests, which means they'll test before birth for Fabry disease, are called chorionic villi sampling, or CVS, and amniocentesis. With chorionic villi sampling, you can do it earlier in pregnancy, usually between the 9th to 12th week, although you can do it later. And what you're doing is you're using basically a probe with a needle to go in and take some of the pre-placental tissue from around the baby and then go test it for Fabry disease. You can either do it vaginally, where you go in and pull some of the placental tissue off. Sometimes I'll do it with a needle going down through the abdomen to pull some of that tissue off. And this way they'll test early and see if the baby has Fabry disease. With an amniocentesis, you wait a little bit later, about 14 to 16 weeks of pregnancy. They use a needle to take some of the fluid from around the baby, not getting the baby themselves, but the fluid from around the baby and getting the cells that are floating around the baby that come from the inner lining of their urinary tract and from skin cells. And they grow those cells to see if the baby has Fabry disease. In both cases, there are risks with these procedures. With amniocentesis and CVS, you want to get somebody who's done it as frequently as possible, because the more you do it, the better you are. You want to work with somebody who uses an ultrasound to see where the baby is. And with the amnio, what we're doing is they actually put the needle in and they take the needle out, and they're left with a little plastic tube. So even if the baby bumps it after the needle's out, it's not a problem. But you can get cramping with amniocentesis. There's everybody's got a different number, but about 0.5% chance for complications like fluid leaking all the way to something like a miscarriage. Chorionic villi sampling, the risks are a little higher because you're doing it earlier. And there's been some data about other complications besides spotting, bleeding, and miscarriage. In all cases, in experienced hands, this can be done very well and as safely as possible, but there's always that risk. And that's why some people are like, well, I would like to know as soon as possible. Let's do it when the baby's born and not when they're in utero, and it takes some risks. Some people are like, I need to know now, and I'm gonna do these tests. And so if you're interested in learning more about these tests, you would talk to your OBGYN and see if they send you to a high-risk baby doctor, a maternal fetal medicine specialist, to do these tests, or who does them. And they can give you their specific risks. The other thing you can do as soon as the baby's born, you've got your placenta, you've got the umbilical cord that's no longer attached to the baby, and you can pull the blood out of the umbilical cord and send it off for Fabry testing. So that's a way that you don't have to poke the baby, you don't have to do testing before birth, and you can know, as long as it takes to test, which is sometimes between 2 to 4 weeks, to see if they had Fabry disease after they're born. And that's using that blood that's in the cord. You can also wait till later if you want to wait until the child's older and makes a decision for themselves to learn if they have Fabry disease, remembering that sometimes they're going to learn if they have Fabry disease because the symptoms. Still have to test though, because different medical symptoms can look like Fabry disease, because they're really nonspecific when you're a kid. The decision is yours though. When we talk about having babies and thinking about having babies when you have Fabry disease, nobody should tell you what to do. And I love this quote: "Don't base your relationship decisions off the advice of people who don't have to live with the results." This is your choice. If you are going it alone, it's your choice that way. If you have a partner, you talk with them and figure out what makes sense for you as a couple. Just know that there's different things you can do before you're pregnant and when you're pregnant to figure out how to test. But we can't fix anything, right? We can't just change. If you know a baby has Fabry disease, we can't, change everything. We just know that we want to start treatment early. Not exactly when. We still need to know. We don't know exactly if we want to start at 5 or 10 or, what the best timing is to make sure that there's less symptoms as an adult. But this is your decision. I gave you some quotes from people who've been there, done that, and then you can use those as starting points for your own discussions. And remember that there's a big Fabry community out there. Finn, all your country-specific organizations. Remember, we have a huge support group and a huge network of people to talk to. And if you have questions, if you're trying to make a decision, talk to them. You're doing yourself a disservice if you don't go talk to them. And this is my family tree. I can tell you that I had an amniocentesis with both boys, not because of Fabry disease, but because of other stuff. And it's just a choice that people get to make for themselves. So I'll take any questions now through chat or voice, or you can always email me. Thanks for your attention.